Okay, so this is part 2 of the lecture, and I'm going to talk now about what do you do for your patient who has a sprain, a strain, or a break. Most of the time when you're taking care of patients who have strains, sprains, or breaks, you're going to be taking care of them in outpatient. So this is something, if you end up working like in the emergency room or trauma, you're going to see these types of injuries. Most of the time it's occurred because of a trauma. And then you need to know what to do about it and how to assess those things that we're doing about it as a nurse. So I brought a model here. I'm going to show you how to apply some of these things. So the first thing that we're talking about traction in a minute. I don't need my model here for that. But I want to show you some of the different kinds of braces and splints that we use for our patients who have strain and sprain injuries. So most of the time when you have a sprain injury, it's going to involve a joint. Typically it's going to be your ankles and your wrists. Those are the two joints that are most prone to a strain injury. And a strain injury really is an overextension of the tendons and ligaments. Can you take that out and then take those up too? It's an overstretching of the tendons and ligaments in the wrist, and most of the time this is going to occur because of trauma. So for example, you're a basketball player, you're shooting a hoop, you land on your wrist, it's sprained. Same thing with your ankle. Soccer players get it all the time. Soccer players tend to have knee injuries, and those tend to be sprains, knee sprains, or sometimes strains because of the lateral tendons here. So that's how people can tear out the tendons in their knees. So what you're going to do when somebody comes in with a trauma, they will be complaining of pain. It will swell, and this is one difference between a strain and a sprain and a break. The sprains and strains tend to swell. Breaks don't swell as much. You might have a little bit of swelling, but not nearly as much. And your breaks tend to have more bruising, just like a localized bruising, whereas your strains and sprains are going to have bruising all in the area, more of a diffuse. So step one, you always have to get an x-ray just to make sure that it's not broken. But there's some telltale signs. When somebody has a strain or a sprain, versus a break. The strains and sprains will still be sore and tender, but they'll still be able to like move their wrist. If you say, can you wiggle your fingers for me, they're going to still be able to do that. Might be a little bit uncomfortable. Whereas a break, they can't do that. If you ask somebody to move when they have a break, they won't be able to move that affected limb. So once you get an x-ray and confirm that you don't have a break involved, then you're going to treat that sprain with a splint or a brace. And you're going to want to do the RICE that we've talked about, the rest, ice, compress, elevate. But I want to show you how to apply some of these different braces, because if you apply it wrong, you can actually cause more damage to your patient. You don't want to do that. So I brought some stuff to show you. And a lot of these you can get over the counter. So if somebody your brother falls at home and you don't feel like going to the ER, you're 99% sure that it's not broken, you can do these things at home. A lot of these you can just get over the counter. So for example, this would be something for a thumb. So a thumb brace. So like let's say that your patient perhaps fell off a horse and sprained their thumb. Now again, it's the joint right here and it gets sprained. The sprain again is the tendons and ligaments around a joint, whereas a strain injury is more of an overstretch of the muscle, not necessarily associated with the joint. So your patient comes in, joint is swollen, joint is tender. You can put a brace on that's going to be specific to that joint. So you're going to open it up, you're going to slide it underneath and right around on that wrist. You want it snug, but not so snug that it's going to cut off circulation. So most of them have like associated Velcro straps on, and basically what you're doing is you're just immobilizing this joint. And most of these braces are made for a specific body part. So now, for example, your patient who just has a thumb sprain now can no longer move that thumb. So now you've got the compressed part of the rice. So your patient goes home and you're going to have them elevate this above the level of the heart so they can lay down, they're going to chill, they're going to watch TV, they're going to put this up on a pillow, and you're going to have your patient applying ice right over this joint for, you know, on and off for 24 hours. They're not going to move it at this time, and then you're going to put them on NSAIDs, which is going to reduce the inflammation. What you're also going to watch for at this point is the swelling and what am I trying to say? Vascularization, the blood vascularization down in here. So now that you've got this joint that is traumatized, I'm going to assess the distal thumb to make sure that it's warm, that I'm getting good blood supply there, as well as in these fingers. And periodically, you're going to have your patient just move their fingers. Can you move those fingers for me? Assess pain, treat them for pain every 6 to 8 hours, and that should start getting better. You're going to want to wear the brace for maybe a week to 10 days. The nice thing about a brace, unlike casts, is you can take it off when you're getting in the shower, things like that, and then you'll teach your patient to put that back on. So that's one example of like a thumb brace. Sometimes if your patients come in and have a more significant injury, like for example, let's say you want to immobilize their entire wrist. Let's say you've got a big wrist sprain. You can use something like this, and if you'll notice, see on the inside, it's nice and cushiony here. There's a lot of cushion at the top, and ones like this are ergonomically really nice for that inside hand. So you're going to have your patient put their hand in here. This might be a little bit uncomfortable, especially at first, because the patient is going to be in pain. But again, there's a spot for the thumb. The nice thing here, lift those fingers up, there's a spot that these can rest right on that cushion, and then again, you're just going to wrap this around, snug, but not so tight that you are cutting off circulation. And again, you don't want it so loose. So if I just did this nice and loose like this, now your patient can move their hand around in there, and now you've not compressed enough to keep the inflammation down. That's the whole point of the compression, is to help keep that inflammation down. So you want it nice and snug, and in this case, because you've got this band right across that radial artery and the ulnar artery, you're going to want to make sure that those fingers are staying nice and warm. You're going to want to make sure that they're not getting purple. So this is another kind of brace. Sometimes they make braces, you know, as big and as, you know, simple as a neck brace. This is your common neck brace where your patient comes back in. Let's say that they have been in a car accident, they've got what we call whiplash, and in a whiplash injury, that is just a muscle strain. These neck muscles are overstretched beyond their capability, so you're going to want to give some support to that neck so your patient doesn't have to work to keep their neck up. So again, you're just going to put this around your patient. And this would be important to make sure this patient who has a neck injury following a trauma like in a car, you're going to want that they will come off of the ER, from the ambulance or the fire with the hard plastic C-spine collars. You're going to need to make sure that this patient has good C-spine, and by C-spine, I mean these vertebrae right in here. You're going to need to get a good x-ray of that, make sure that they're not fractured, and then you might have your patient in something like this, like a neck brace, just while the neck strain is healing. So that's what patients like this would not be okay if those vertebrae are fractured. Then that patient would be in something different, like a halo. The other thing that I talked about in the other lecture is something called a splint or a sugar tong, and these kinds of braces are especially good if your patient does have a broken bone. Now you'll notice the difference between these types of splints and this, because this has a very hard outer shell, but what it does is it expands. These kinds of splints or tongs are excellent if your patient has a broken bone and there's a lot of swelling. So, for example, let's say that your patient broke their ankle. It is not uncommon to have like a broken ankle plus a sprain on top of it, especially in your high impact athletes, your football players, you know, things like that can have, soccer players are big. So if they have a break here and it's swollen, you're going to have a lot of swelling. The problem is if you cast it right away, then the swelling goes down, now your cast is too big, your bone is moving all around, and you're going to get malunion. So oftentimes what they'll do in patients that have this kind of injury is they will start out with something like a splint. And what you're going to do on a splint is you're going to put it on either side of the injured joint like this. You're going to clamp it around, and this is kind of going to mimic a cast. Again, you're going to use these little Velcro straps, wrap it around like so, like that. And now I have immobilized this bone, but there's enough expansion here so if this joint is continuing to swell, it's not going to cause compartment syndrome down in her toes. So again, I'm going to probably send this patient home from the ER with something like this on. Have the patient lay down on the couch, elevate, ice, Motrin, probably go back and see the orthopedic surgeon within the 24 hours. Hopefully this swelling will go down and they can actually cast it with a permanent hard cast. So these are called splints or tongs. You're going to see a lot of those in your patients who have bone traumas. They do make things that are much simpler for your patients who have sprains. So for example, if your patient has just a swollen ankle, sprained ankle, they're a soccer player, there's all kinds of things like this on the market. This is a nice one. This is like an ACE wrap that you would just slide right over the patient's injury, like their ankle or whatever, and then you can use this just like you would an ACE wrap. There's a little bit of rubber to it, and you just slide it around. Now when you are wrapping a sprain, and I'm going to show you how to do an ankle, and then I'm going to show you how to do a wrist. You're going to want to wrap it from distal to proximal. And the reason is you're going to want the swelling to go upwards rather than congregate down in her toes where compartment syndrome can start occurring. So you're going to put the base of it here, and then you're just going to slowly wrap it. What you're going to want to do is support the injury. So you're not really trying to immobilize it as much as you would if your patient had a broken bone, but you're just wanting to offer it enough support. And see how you're twisting it and you're layering it on top of each other, causing the fluid to shift this way. You're going to wrap it up and around, tighten it on itself. And what this does is it feels really good on your patient who has trauma, and because it's going to be painful. Feels really good, keeps the swelling down, the inflammation down, and it helps just offer some support while this joint is healing. The other thing, like a lot of your patients, and this is really common in nurses, is to have back strains. Back strains are these big, your two big back muscles right in here can get very damaged very quickly, especially by improper body techniques. And this is a very common area for muscle strain, especially nurses or anybody who's doing heavy lifting. You will notice if you go into Home Depot or places like that, a lot of people in there are wearing these to give the back some support. And you'll notice in these, this is a back brace, there is a cushion here like this. You're going to want to put that right in the small of the back. And then you're going to wrap this around your patient. And now see how before I turn her around, see how this is solid in there? That's going to give these muscles a lot of support. And then you're gonna bring this around. You wrap it on your patient, and it's fully adjustable to, you know, there's different, however big your patient is. You just put the Velcro on, wrap this around on your patient. And that's going to offer both anterior and posterior support in your patients who have muscle strains in their back. Finally, the easiest one, the one that you'll probably do most often, is the ACE wrap. So I did want to show you how to put on an ACE wrap, although that's a little bit of old school. But if you're working in an ER and that's your first line of treatment for your patient, you're just going to slap on an ACE wrap. So I want to show you how to do an ACE wrap. So this is how you put this on both a wrist and an ankle. You do the same thing for a knee, but I want to show you how to do it because you can't graduate from nursing school not knowing how to put on an ACE bandage. So let's say that the wrist here is the location of the injury. So I'm going to want to provide most support right here, keeping in mind I want the swelling to flow proximally and more towards her core. So you're going to start this right here, and you're going to hold your fingers on her palm like that, and you're going to want to go in on this thumb. You're going to come around, and the easiest thing to do is double it back on itself, like that. So now you've got an anchor. So you've just anchored it in place right there, okay? So then what you're gonna start doing is you're gonna wrap it up. Oh, shoot. Okay, you're gonna wrap it up around the thumb. You're gonna go around this joint. You're gonna come up a couple of more times around this joint. This ACE wrap that I'm using is too big for the area. And then you can go back down. And what you're doing is just offering a little bit of support, but you're going to remember you want to start from the bottom and go up. But it's okay to go back down because you can have a couple of layers on here. Another thing, let me show you a little trick you can do with an ACE wrap. So let's say this person has a sprained thumb and a finger. Let's say I want to go between the finger. So you can go around here, and then you can almost fold your ACE wrap. See? Hold up. So see, you can fold it, go in here, because now I'm going into like a smaller little area like that. You're going to go back down around the thumb, then you can open your ACE wrap back up. Go back down around the thumb. Now what I'm doing is I'm just securing this little part in there. Go around here, back up, and then you would secure it. And they have those little clamp things, little Velcro things. And now what I've done is I have given this a lot of support. I have immobilized both the finger and the thumb. I'm going to have my patient keep their arm up. I'm going to ask your patient, does that feel okay? Are you experiencing any pain? Is that uncomfortable? And then you're going to send them home like that. You probably want to teach them or whoever they're with how to wrap that. You know, people can do this at home, but they do need to know, they need to feel how snug it should be, because patients who put these on at home can tend, they tend to make them either too loose or too tight. You're going to want to teach them how to watch those fingers. Those fingers should not be getting blue. They should stay warm, but there should be enough compression on there to keep that inflammation down. So, okay, so that is how you apply braces, splints, and ACE wraps. So then in the next segment, we're going to talk about traction and casts. So. Okay, thank you.